Hello, I am Dr. Pestana Knight from the Epilepsy Center at the Cleveland Clinic, where I practice pediatric epilepsy. I want to thank Lee for organizing this conference about empowering epilepsy. And the topic that I will be covering today with you is stigma in epilepsy. I have nothing to disclose. And today we are going to briefly cover what is a stigma, where the stigma in epilepsy comes from, how a stigma affects patients with epilepsy, and how we can overcome the stigma. So the first thing that I want to talk about is what is epilepsy. And epilepsy is a chronic condition of the brain and is defined as an enduring predisposition to generate epileptic seizures. And at least you must have one epileptic seizure to consider that you have epilepsy. But more recently, the neurobiological, cognitive, psychosocial, and social consequences of epilepsy have been added also to the definition. The treatment for epilepsy includes anti-epileptic drugs, diets, epilepsy surgery, and neurostimulation, but also identifying and treating the comorbidities associated to epilepsy is a key part of the treatment that we can provide today. As you see, the list of comorbidities include conditions that bring a stigma on their own. So often we find that the patients are dealing with epilepsy, but also with a stigma attached to depression, anxiety, attention deficit disorder, autism, PTSD, or bipolar disorder. And there are other conditions as well. Before we go on the details of stigma, I want to mention to you what are the determinants of health. And the reason that I want to do that is because when we think about the determinants of health, we think about where are our opportunities to help people with epilepsy, to change the stigma toward people with epilepsy. And you see that the policy making is a very important program because these are the programs that provide access for the people with epilepsy to care. And also, there are specific programs such as Epilepsy Out of the Shadows that contribute to a better awareness of the public about what is epilepsy and how to deal with the condition. There are social factors that are key for the stigmatization of the disease, and these are social and physical conditions that are around the environment where a person with epilepsy is living. The health services are very important because they guarantee access to good quality health services. And of course, the individual behavior is an important part too. And this is how you see yourself in the setting of having a disease, the foods that you choose to eat, the physical activity that you can do, and also an important part is the treatment adherence. And of course, there are biological and genetic factors that contribute to having epilepsy or not. We all know that epilepsy is more common in younger kids as well as older people. So how many people are living with epilepsy in the United States? Well, a recent report from the CDC from 2017 reports that around 1.2% of the US population have active epilepsy. Let's talk now about what is a stigma. So if we look at the Merriam-Webster dictionary, we find that the definition of a stigma is a brand, stain, a mark, but it's typically used in society as a mark of shame, disgrace, dishonor, opprobrium, or humiliation. So the term carries typically a negative consequence. The stigma and misconceptions that surround people with epilepsy affect how the general public understands the condition, how the general public relate to people with epilepsy, and this affect the response that the public will have to a person who has seizures or a person who is witnessing a seizure. Also, people with epilepsy have limitations that affect how they think of themselves and as individuals. And regarding this topic, we can have a whole lecture, but we will save that for another day. So to talk about the stigma for epilepsy, we need to look first at where the stigma comes from. And as you know, the epilepsy is a very old disease. It has been known for many, many years and centuries. And it was the ancient Babylonians, the one who have the initial description of the disease. The first description of the disease appeared in a book, Sakiku, which means all diseases. And in this book, there is the first description of different types of epileptic seizures. So it has been for a very long time that there are different types of epileptic seizures. This is an important point to move forward, because oftentimes we find that people only recognize as epileptic seizures the individual that is having a convulsion, but there are individuals who are having accent seizures, seizures with alteration of awareness, seizures with focal motor features, etc. So where the word seizure comes from? And the word seizure comes from the Greek, and it means to take hold of. You can see that the word per se carries the meaning that there is a degree of possession of the body when the person is experiencing a seizure. Therefore, there have been over the centuries different explanations about epilepsy. And one of the older ones, and they are dismissed in many communities, but it still persists in others, is that the epilepsy is caused by divine interventions. The Babylonians considered that when the person experienced an epileptic seizure, what was happening is that the body was invaded by an evil spirit. Others considered at that time that this was a sacred disease. Of course, the treatment was along with the explanation of the cause, and at that time, the treatment was spiritual with prayers. And in some communities, still, this is used today as a form of treatment of epilepsy. The disease also was known in the Middle Ages as the falling sickness. Again, something is taking over the body, there is a possession, there is falling evil. And the term of lunacy came upon the knowledge of the people of the time because fluctuations with the seizures were observed, as well as fluctuations with the mood of the person were observed, particularly around the moon. And at that time, there was a big contradiction between what it was rational and what it was superstitious and what it was magical and religion. Therefore, the treatment for epilepsy in the Middle Ages include diets and drugs, but also a lot of remedies, like drinking bloods or wearing bones or carrying certain plants or precious stones, amulets, or even observing the mood. Oftentimes, fasting and prayers were part of the treatment of epilepsy in this era. In the Renaissance, the epilepsy was very attached to the idea of wickery. This was a time of the witch hunting, it's a witch hunting period in the history, and oftentimes these patients were burned alive in order to bring out of their body the demons of the curse that were given to them by the gods. As you can see, these were horrible times for people with epilepsy, and certainly a contribution to the stigmatization of the disease, as seeing these people are possessed by devils. In some other communities, people fare better, and the divine intervention made consider the people who have epileptic seizure as prophets. So they became leaders of the communities because they were considered that they were gifted by the gods. If you want to read more about this concept, I highly recommend the book The Spirit Catches You and Then You Fall Down. It tells the story of a monk kid that moved to the United States, and now this concept of being a prophetic has to be work with the modern concepts of treatment of epilepsy. It's a very interesting book. This belief that they were gifted by gods, people with epilepsy were granted important positions in the community, such as shamans and healers. Another explanation for the epilepsy that goes back to the antiquity is that the epilepsy was an infectious disease. And people start adopting behaviors when they observe somebody having a seizure, such as spitting or refusing to eat or drink from the same dishes as the people with epilepsy. Treating the epilepsy as an infectious disease, it was that the very first treatment for epilepsy came upon the knowledge of the physicians of the time in 1856, when they figured out that the bromides could help with the treatment for epilepsy. The bromides at the time was the only medication to treat syphilis, and of course the syphilis was poorly identified and there were no antibiotics. So a lot of the patients with syphilis developed neurosyphilis, and the neurosyphilis produced seizures, so these people suffer from epilepsy. So this was one of the first treatments that we use, and if you see, the treatment from the Dravet syndrome, which is a well-recognized genetic form of epilepsy today, include in some communities, and this is a study from Japan, the treatment with bromides. And you can see, if we again think about what was happening in the antiquity with several infections like the plague and flu, etc., conditions in which a massive amount of people will die from rapidly spreading infectious diseases. A number of them develop seizures because this systemic disease did not spare the brain. And you can see how the belief that epilepsy was contagious still persists in our minds today. Finally, we are getting closer to what epilepsy really is, and epilepsy is a brain disorder. The recognition of epilepsy as a brain disorder goes back to the Hippocratic school, where they proposed that the seizures were indeed originated from the brain, as well as the intellect, the emotions, and the behavior. But in the Middle Ages, because epilepsy was coming from the brain and people who have suffered these conditions were considered insane, they were enclosed in asylums. They were separated from the community and they were living in isolation in these asylums. In the 17th and 18th centuries, there was a fight against the supernatural and the occult theory. And people with epilepsy were confined in wards for the insane, in prison-like institutions, and they were not allowed to socialize or intermarry. Physicians tried to separate the neurological from the mental disorder based on the knowledge about epilepsy, but as you know today, up to 50% of people who have epilepsy could also have a comorbidity that is neuropsychiatry. In the 19th centuries, there were a lot of advance on the understanding of the brain anatomy and the pathology, and this contributed to a better knowledge about the epilepsy. There were specific type of seizures described. It was recognized that if you have a motor seizure affected one side of the body, you could end up paralyzed following the seizure. And the physicians trying to start making differences between epilepsy attacks, hysteria, and other non-epileptic paroxysmal disorders. The picture on the top displays a person having a seizure with dystonic posturing on the limbs, and the picture below displays the famous arc of circle, which was initially attached to the concept of a psychogenic seizure, but we know today that this particular out movement can be seen during epileptic seizures as well. In the 19th centuries, there was a clear separation between the field of neurology and psychiatry. And other concepts that affect how people see a patient with epilepsy today occur also in the 19th century. And the idea of the epileptic character as somebody who can foster jealousy, can have uncontrollable anger, can commit crime, came upon the belief that this was a part of having epileptic seizures. Whereas in reality, we know that people who have epileptic seizures have seizures that are very well controlled and can have a very normal life and be useful and an integral part of our communities. This is a picture of our famous Vincent van Gogh that, as you know, suffered from epilepsy and also mental health disorders. Another of the beliefs about where the epilepsy came from was as a genetic disorder. This idea began in the 19th century, and I think that Dr. Gowers was a pioneer of his time because he estimated that epilepsy was inherited in around 30% of the cases. And he was not far along, because in 1975 we have clear etiology for around 1/4 of all the epilepsies, whereas the main remain idiopathic. But since the year 2000, with the rapid development of genes, now we understand that a lot of things are monogenic diseases or single gene diseases, and yet some epilepsies still exhibit some complex inheritance. So today we have knowledge that can support the knowledge of Dr. Gowers in the 19th century. Thinking that epilepsy was a genetic disorder also have bad consequences for people suffering from epilepsy. In 1933, epileptic inmates in the asylums, they were sterilized to prevent passing down the bad genes. In 1982, the state of Missouri repealed a law that prohibited epileptic people from marrying each other. And you can see now we are talking about very recent years. And in 1986, South Carolina permitted forced sterilization of women with epilepsy. All this in response to the idea that people with epilepsy could pass their genes down. So now we have heard all the ideas that exist in the communities about the causes of epilepsy and how they can impact and stigmatize people with epilepsy. But how the stigma impact people with epilepsy today. This is a cartoon of one child that says that she is feeling different because she has epilepsy. And oftentimes when we work with children, they are able, by using the arts, to convey to us the feelings and emotions that they experience about having seizures and being treated different by not only their friends at school and teachers, but also by the parents. So children can say that they feel sad, anger, they are fearful, they have disgust sensation, etc. And here is a drawing of one of our patients who said that the feeling after seizure is fear. He feels fear. This is a work that we did years ago with adolescents, trying to get them also to express how they feel about their epilepsy yourself. And you see the theme of being different, being confused, having worries about living with epilepsy, living between a light and a dark place, a beauty and a dark place, etc. And also how children can, via the art, use that activity to control their emotions when they are fearful about their seizures. In the schools, there is still a negative perception about epilepsy. This is a result of a survey in which 22% of adolescents reported uncertainty about epilepsy being contagious. If you look at the publication of this article, we are talking about 2002. 50% of the families decided to keep the condition a secret from others, so they did not communicate other parents or the teachers that their child have epilepsy. This is still happening today. 50% of the families decide not to disclose the diagnosis of epilepsy to the teachers at school. And this is a work from our own Dr. Falcón in 2011. 1/4 of the families that were surveyed believed that having a child with epilepsy in the classroom deteriorated the learning environment. Another wrong idea. Now, how about with adults? Stigma with epilepsy also affects adults living with epilepsy. This is a survey from the Epilepsy Foundation in 1995 that compared the results of the people with epilepsy that they served survey with the US Census in 1995. You can see that people with epilepsy have lower marriage rates for women and men with epilepsy. The household income was lower than the mean population. The rate of graduation from high school and college was also lower for people with epilepsy. 25% of the people were unemployed at the time, and more than 60% it was because of the epilepsy per se. Stigma also can have negative connotations on the attitude of people toward their treatment. Specifically, if we talk about epilepsy surgery, we can see that the decision to say yes to epilepsy surgery in people who have temporal lobe epilepsy is affected by the stigma, particularly in African American females. Also, the stigma affects what is the expectation of the person after epilepsy surgery. So people who experience more stigma, they expect to have less seizure or being seizure-free after epilepsy surgery. But I feel that they will not gain an employment because they have lost years of education. So this concept brings to our mind that rehabilitation is a very important process to reincorporate people with epilepsy to the society once they have become seizure-free and have their treatment for epilepsy surgery. But not only surgery is affected by, the decision about surgery is affected by the stigma, it also the adherence to medication. Because in some communities, the medications are seen as being poison or being exposed to toxic elements that will make you sicker. And these are our modern beliefs. You can see that these are publications from 2005 and 2011. The idea that medications are harmful are still very present in the population. And this is really a battle of uphill trying to explain to the families what is the line of the benefit that you will get from the medication and what side effects can be tolerated and what really are unacceptable. So a stigma can lead to a medical care that is underserved, in part because of the stigma of asking for help. It leads others to avoid living, socializing, or working or renting to people with epilepsy or employing people with epilepsy, and not only epilepsy, also mental health. The stigma leads to low self-esteem and hopelessness. It deters the public from seeking and wanting to pay for care. A stigma often causes people with mental illness and epilepsy to become embarrassed or ashamed, so they conceal their symptoms. They avoid looking for treatments, for services, for support, not only in the healthcare facilities, but also in the community. So what can we do to overcome the stigma in epilepsy? Well, this is what Lee is doing here today, and is Education Wins. With this conference, we hope that we can accomplish to provide you an up-to-date education of what is epilepsy and how it's treated and how it affects our lives, the life of the people living with epilepsy. And really, the education needs to be starting with the patient and their families, but it has to go to all the areas and communities surrounding the patient living with epilepsy. This includes our communities and organizations, all the health professionals that deal with the disease, and in special the government, so the right resources will be allocated to fight the stigma against epilepsy. So how can we make a difference? Well, learn the facts about epilepsy, mental health, and the comorbidities. Confront the myths about epilepsy and mental health. We went through some of them today. Screen for symptoms of mental illness, treat them, and refer the patient to the appropriate treatment. Treat people with mental illness and epilepsy with respect and dignity, like everybody should be treated. And respect the rights of people with mental illness and epilepsy, and don't discriminate against them when it comes to housing, employment, and education. Again, Education Wins. I'll be happy to take questions. If you have questions directed to me specifically, you can email me to pestane@ccf.org. And with this, we are concluding the presentation of today. Thank you very much.